Good morning, everyone. We'll be starting momentarily. All right. Well, I'm going to begin now. My name is Scott Butler. I'm the Manager of Policy and Research at the Ontario Good Roads Association. It is our distinct privilege to be hosting this webinar today. This is the third one we've done looking at this topic. It is timely given the impacts of the pandemic are starting to be felt more widely, and it's addressing a number of concerns that we've been hearing from our municipal members. Joining us today to walk us through this presentation are two individuals familiar to many of you on the call. Charles Painter is a partner at Patterson McDougall LLP. Charles is widely regarded as one of the brightest legal minds when it comes to municipal liability anywhere in Ontario. He will provide an overview of what the legal liability framework is. We're also enjoy the benefit of having Brian Anderson, road specialist with Frank Cowan Group, one of the largest municipal insurers, online as well today. Brian has decades of experience overseeing road operations in a number of different areas in the province and was at one time the manager of member services for the Ontario Good Roads Association. The flow will be quite simple. I'm going to run you through sort of a state of affairs of where we're at in regards to COVID-19 in Ontario and the government's response to date. Then I'm going to turn the microphone over to Charles, who will run through his presentation, and then Brian will run through his presentation following Charles. You will see in the GoToWebinar module that has popped up on your screens a question field and a chat field. Please feel free to pose any questions in there. I will be directing those to our panelists throughout their presentation. We'll also leave time at the end for some question and answers. And yeah, I would encourage you, any questions are certainly welcome, particularly given the fact that you have two bright individuals on here with years and years of experience, and they're doing this for free. So make use of their brains. So to begin, I'm going to, as I said, just run through a quick update on where we're at in terms of COVID-19's presence in Ontario. As of last night, these were the up-to-date figures provided by the Ministry of Health. Almost 39,000 people had been tested. 835 had been confirmed positive. There had been 15 deaths as a result, and there are almost 11,000 outstanding investigations currently underway. The provincial government has enacted a provincial emergency, and they've identified some key priorities. They're looking at hospitals, monitoring hospitals for potential cases. They've also amended some of the public health legislation to specifically address the risks and the challenges posed by 2019 novel coronavirus, or COVID-19. And this has triggered a whole series of secondary consequences, such as putting in new measures to investigate, completing lab tests in a more expeditious manner, and undertaking a whole series of initiatives designed to control and further stymie the spread of the disease. Okay, sorry, we saw somebody who had a technical issue, and I was afraid I wasn't being heard there. In addition, the province has also enacted a command table at the provincial level. And this is a series of bureaucrats, senior bureaucrats, that are looking at ways to enhance access to screening, expanding lab testing capacity, and implementing new initiatives to keep frontline healthcare workers safe. On Wednesday, so that would be Wednesday of this week, the province announced a fiscal update. Typically, it would have been a budget, but this was what they've been calling a mini budget. and they called it Ontario's Action Plan Responding to COVID-19. $148 million was earmarked for charitable nonprofit sector organizations such as food banks, homeless shelters, churches, and other emergency services that are responding to the COVID-19 crisis. That money will flow through municipal service managers or district social service administration boards. Another $1.8 billion in educational property tax that's due to school boards is being deferred to June 30th. And those are two of the primary impacts on the municipal sector that have been identified or that were identified during that mini update. What OGRA has done so far, as of Friday, March 13th, staff have been working remotely. All of our educational and professional development offerings are being rescheduled right now. Looking at dates later in the year, our intention is to make sure that members have access to those services. We also, as this webinar would indicate, engaging our members to understand where there are opportunities for us to provide information to you that affects the delivery of transportation infrastructure services at the local level. So I would encourage you, if there are issues out there that you're looking to understand better relative to COVID-19, by all means, feel free to reach out to us and we will do our best to provide you with some answers. With that, I'm going to turn the presentation at this point over to Charles Painter from Patterson McDougall LLP to run us through the legal framework. Charles, the floor is yours.
Good morning, Scott. Good morning, everybody who's online here. Thank you. We're going to go through a little bit of background information to begin with, and then I'm going to focus on minimum maintenance standards and other steps that I think municipalities can take to try and mitigate the risk of litigation down the road after this crisis is over. If there are staffing issues or an inability to meet level of service targets on your highways with respect to COVID-19. So Scott, if we could move to the third slide, we'll skip the second one, which is my lovely picture of the virus floating around somewhere. I want to give everyone listening some background. This is a chart prepared by the Department of Homeland Security in a document called Pandemic Influenza Preparedness, Response, and Recovery Guide for Critical Infrastructure and Key Resources. This document was prepared many years ago and is still in place today, and it shows the different levels of alert that the World Health Organization has for a pandemic situation like we find ourselves in on the left. That's in the gray-blue shaded column. And on the right is the United States Department of Homeland Security risk levels. As you can see, we are clearly within the bottom portion of the chart, the pandemic period, and at level 5, according to the Department of Homeland Security, which is spreading out throughout the United States. I won't spend too much time on this because I want to leave some time for Mr. Anderson to speak as well as for questions, but the reason I put this slide into the slide deck is what you can see is the United States and other countries have for many years since 2003 and the SARS outbreak looked to the future and realized that we are constantly going to be dealing with pandemics, taking a long view of history as it has unfolded since 1918 and the Spanish flu outbreak. We are well within this pandemic, and the next phase will be the recovery and preparation for subsequent waves phase. So the United States has already looked into the future and realized that when we deal with this situation, the initial pandemic will occur, but there'll be subsequent waves in recovery time that we all have to plan for. Let's go to the next slide, please. Back in 2005, the province of New Brunswick put together its own pandemic influenza planning guide for municipalities. This document's quite interesting as a background document because back in 2005, the document states in its background section that 500 to 1,500 Canadians die every year from just regular influenza and complications, and between 1 in 4 and 1 in 10 is infected with the influenza virus during each flu season, which in and of itself can cause and does cause significant impact on health and productivity. The document recalls that 3 times in the last 100 years, there have been worldwide pandemic influenza strains that caused high rates of death and illness. The 1918 Spanish flu is cited. And what I found prophetic to a certain extent, but also interesting, is this underlined section: the next pandemic is expected to cause high rates of death and illness, resulting in a tremendous amount of social disruption. That's what we are dealing with right now. Assuming an illness rate of 35%, was estimated that over 120,000 New Brunswickers would seek medical care during a pandemic, and an attack rate of 35% would mean that 1/3 of municipal staff may be out at any given time, and that some would die, and that this would cause an enormous strain on health services and create human resource gaps in essential services for all communities. What we're dealing with now is a situation where far more than 1/3 of municipal staff are currently out, either quarantining at home or socially distancing as ordered by the province, other than for essential service delivery. So what New Brunswick was looking into the future and predicting has been far exceeded by the COVID-19 outbreak by a significant extent. And that is an issue that I'm going to talk about a little bit later when we talk about what judges might do in the current situation in a lawsuit. Let's go to the next slide, please. The town of Kapuskasing in 2009 published its own pandemic influenza plan. And again, the upshot of this slide is to show that what we're dealing with now is far worse than even they thought would be the worst case scenario. You'll see that their document says that an influenza pandemic would affect all of Ontario as well as the country, and a worst case prediction was to be used. As a basis for planning, they assumed that they wouldn't get much of any assistance from the province or federal governments other than vaccines or drugs, that the town would have to plan and respond on its own to a pandemic using its own resources primarily, and that an attack rate of 35% would be assumed when planning for the effects of an influenza pandemic. And there's a note that an attack rate of 35% means that over the course of the pandemic, 35% of the population would have influenza severe enough to take 3 days off of work. Well, what we're again dealing with is far beyond what was predicted as a worst case prediction under this plan. And I would argue, based on what I'm reading, pretty much every municipality out there with a similar plan never envisioned or anticipated the COVID-19 having such a dramatic effect on people's lives and ability to perform work. Let's go to the next slide. The courts, although it's not an insurance doctrine, the courts have talked about acts of God in the past. And this goes back to the 1800s and most likely even earlier. This is an 1878 decision where the court said that an act of God is a phenomenon need not be unique to amount to an act of God. It is sufficient if it was extraordinary and could not have been expected. In other words, when you look at the question at law of foreseeability, was a pandemic foreseeable? Definitely. There will be no argument at trial with any judge that a pandemic similar to SARS was foreseeable. What wasn't foreseeable until it unfolded was several of the unique attributes which this particular virus has, which, as everyone knows, is that you can be spreading it while you're asymptomatic for a very lengthy period of time. Healthy-looking normal people can be out spreading it, and that the spread rate, or what they call the R0 number, is between 4 and 6. It's way more contagious than any other normal type of flu. It's 3 to 4 or 5 times more contagious. It lives on surfaces far longer, and some of the impacts that it has on human health are far more severe than any previous normal flu, perhaps other than the SARS virus, which was quite deadly. So it is a hybrid of some of the worst attributes of any SARS-type coronavirus, influenza-type virus. And my argument is extraordinary and could not have been expected, at least to its full extent. And that's hopefully some comfort to those of you who worry about what's going to happen if we don't meet our levels of service during this crisis. Are we going to be liable? Are we going to get sued? Are judges going to come after us and judgments come raining down? My suspicion is this type of situation being so beyond the worst case expectations of pretty much every municipality out there, the courts will be fairly understanding, if not extremely so. Let's go to the next slide, please. City of Toronto, when it prepared its pandemic planning, had its Auditor General review the plan back in 2007. This is just a few years after SARS. And the report identified 3 vital responsibilities for the city. And I would suggest to those listening that these are your 3 vital responsibilities going forward and so far to date during this pandemic. Number 1, public health, protecting human health by preventing and controlling the spread of the disease. Many, if not all, of the orders that have been made by the province pursuant to the state of emergency that's been declared are focused on that. Number 2, for you, specifically continuity of your operations, keeping your divisions, agencies, boards, and commissions responsible for maintaining your critical services such as policing, public transportation, that would include the highways, of course, ambulance services, garbage collection, and drinking water treatment are significant and top priority. The third is the health and safety of your employees and to assist them during a pandemic emergency. One may tend to be somewhat in conflict with the other, including when you think about continuity of operations. What you need to do to maintain your services may conflict with doing everything theoretically possible to protect employee health and support. I don't profess to be an employment law expert at all, but I'm pointing this out because it is clearly recognized as a tension and a dynamic that you're going to be expected to do your best to balance through this crisis. Let's go to the next slide, please. The MMS. So I'll start off before I go through this section of the MMS by saying that it is 100% clear that the MMS do not speak in any way to a pandemic. The closest thing that we've done in terms of emergencies is in the latest revision to the MMS, create a significant weather event declaration that allows municipalities, when they have a forecast for a designated weather event that the federal government defines as a weather hazard, to put out an alert in advance. And if it unfolds, it deems the highways in a state of repair due to the weather event occurring. Here we have a pandemic that's affecting staffing levels and the ability to put people out on the roads to do the job. There's nothing in the MMS other than 16.8 that may help. Now, I want to be very clear to everyone listening. I am not saying that you need to close your roads. I'm not advocating it. I'm not suggesting that it's the answer. What I'm saying is there's a middle ground that you might consider, which is partial road closures or partial sidewalk closures. If you find yourself in a situation where you cannot do the job to keep the roads reasonably safe, for whatever reason, including COVID-19 virus pandemic and staffing problems, you can consider taking more limited actions to restrict the type of vehicles that are allowed on certain roads, to restrict or lower the speed limits temporarily during the crisis, to restrict time of day type of use, short of a full closure, something more akin to a temporary closure. You'll see under the MMS 16.8, when a municipality closes a highway or part of a highway pursuant to its powers under the Act, meaning the Municipal Act, the highway is deemed to be in a state of repair in respect of all conditions described in the regulation from the time of closure until it's reopened. Now, sub 2 says, for the purposes of the above section, a highway or part of a highway is closed on the earlier of A, when you pass a bylaw to do it, or B, when a municipality has taken such steps as it determines necessary to temporarily close the highway or part of highway. The temporary closure is what we're most likely obviously dealing with here. So short of passing a formal bylaw, the MMS says when you've taken such steps as you have determined are necessary to close or partially close a highway, then the deeming provision, which says all things under the MMS are in a state of repair, even if they're not, gives you that legal protection. Let's go to the next slide, please. Under the Municipal Act, I just wanted to point out that highways and transportation systems fall squarely within your sphere of jurisdiction. There's no question that you have powers under the Act to both pass bylaws to control your roads and highways, but also to deal with them as necessary in the interest of health and public safety. Let's go to the next slide. Under the Municipal Act, there are 3 defenses at law. I've spoken at this many times before, but it's important to remember that the MMS are not obligatory. They're optional, okay? They're not mandatory. They're not legally required, right? If you choose to adopt them as your level of service, that makes them important to you, but you don't have to defend a lawsuit. That's completely different. So if you're unable to meet the MMS, you're not without legal protection. 44.3b, there's a defense that the municipality took reasonable steps to prevent the default from arising. Every lawsuit exists within a factual matrix. It doesn't exist in a vacuum. Anybody who sues a municipality during the current COVID-19 outbreak and pandemic, where the issue that gives rise to the accident or to the slip and fall or to the trip and fall is that there was reduced staffing and a reduced ability to maintain the roads, is going to be framed in this context. The judge is going to have to consider and be made aware of the fact that we were dealing with this crisis and we were doing our reasonable best, and unfortunately, for whatever reason, the state of disrepair arises. 44.3b is, I think, where most, if not all, of those types of cases where you couldn't meet the MMS are going to be defended. And you should take comfort in the fact that, as I said earlier, a judge is not going to ignore the fact that everyone in the province, including municipalities, had most of their employees quarantined or socially distancing or working from home, and even essential services were deeply affected. Let's go to the next slide, please. Under the Emergency Management and Civil Protection Act, your head of council can declare a state of emergency and take such action and make such orders as he or she considers necessary that are not contrary to law to implement the emergency plan and to protect property and the health, safety, and welfare of the inhabitants. In my view, although the province of Ontario has declared a state of emergency, it's very clear, and I'll show you examples, that local municipalities have followed suit and declared their own local state of emergency. As long as the head of council declares a local state of emergency and any orders or decisions or actions taken pursuant to that locally don't conflict with the provincial declaration and any orders, you're perfectly fine to proceed. And in fact, I would say that if you're planning on doing a temporary road closure for whatever reason, combined with this declaration, you've got greater legal defense for any actions that are taken. It's, in my view, from a lawyer standpoint, the smart thing to do. And frankly, I'm surprised that many municipalities still haven't declared a local state of emergency. Now, I understand you don't want to panic the public, and communication is key. But from a legal standpoint, the declaration costs nothing. It's a press release, as I'm going to show you. And the benefit is there's an ability to take actions and make orders under this act that is fairly unfettered. As long as it's not contrary to law, there's a broad authority granted to the head of council and to the municipality to take actions, again, along the lines of what I'm discussing, which is if you're short-staffed and you're unable to maintain your roads or other infrastructure, with which Mr. Anderson is going to talk about after me, declaring the state of emergency seems to me to be the best way to start that off. Let's go to the next slide, please. Here's the example of the county of Simcoe. They declared a local state of emergency under that act that we just looked at on March the 18th. It's the day after the government of Ontario made its declaration. And so, it's a simple press release. Let's go to the next slide, please. City of Toronto, well after the fact, just recently on the 23rd, so just earlier this week, John Tory released this announcement, and he, as the head of council for the city, declared a state of emergency. in order to deal with efforts to stop the spread of the virus and ensure that the government can continue to act and respond. So this is another example of a municipality declaring a local state of emergency, and that opens the door then to quick action without having to pass formal bylaws and do all that extra work in order to respond in an effective and quick manner to this crisis. Let's go to the next slide, please. The final note that I've made to people is that at some point there may be litigation about who's responsible for the crisis, and I found it interesting that under the Act, Section 12 says where money is expended or cost incurred by a municipality or the Crown in implementing an emergency plan or in connection with an emergency, if it's not implementing a plan but just dealing with a crisis, the municipality or Crown, as the case may be, has a right of action against any person who caused the emergency for the recovery of money or costs. And for the purposes of this section, municipality includes a local board and a local services board. So, there's some discussion, especially in the United States, about China being held responsible for this outbreak, perhaps even others being held responsible if they're not socially responsible. One thing I would say is if you don't declare the state of emergency, you won't have the right to sue later to collect what monies you were forced to spend in responding to that emergency if you haven't made the declaration. And I'll leave it at that. So those are my thoughts and points to make about the MMS and about road and highway maintenance and what might be done. I'll finish by saying I heard that this New York City is actually closing certain roads, but not so much because they can't maintain them, but because they want to create pedestrian-friendly areas so that people can stay more distant from one another while walking, going on the street to certain stores in certain areas. I found that to be an excellent idea as a way to increase social distancing in certain areas. So thank you, everyone, for listening. Scott?
Thank you, Charles. It's Scott Butler back here again at OGRA. And one of the questions that came through while you were just talking to that last point comes from Jamie McCarthy in the Township of Montague. The question is, does the emergency have to be declared? Does it have to be council that declares? Could it be the Emergency Community Control Group? I'm not sure if you're familiar with what those specific terms may be referencing, but I think the issue is who actually, in effect, gets to declare the emergency.
Well, look, I'll say this. Section 4. If we can pop back to that slide, Scott. Let's go back go there. One more. Yeah. No, forward. Forward. One more. Forward. Stop. This is the section about declaring an emergency. It says the head of council may declare that an emergency exists. So I don't believe anywhere in the Act that I've read that there's a legal right to delegate that authority. It may be, but I, as a lawyer who's only read the Act a couple times, this is the guaranteed way to comply with the Act. It says the head of council. So a press release like the ones I just showed you, coming from the mayor or the warden if it's an upper tier, that's the way to do it. So to be safe, if you're planning on doing it, I recommend it be the head of council.
Okay. So what I'm going to do now, I'm going to turn the presentation over to Brian Anderson from Frank Cowan Company to walk us through some of the more operational aspects of what COVID's doing to municipalities out there. Brian, the floor is yours.
Thank you, Scott, and good morning, everyone. Scott, if we go to the first slide. Got a little screwed up there on the slide, but anyway, just to let you know that for Frank Cowan Company, we've been deemed an essential service, and it is business as usual for us. While our offices are closed, all but a handful of staff is working remotely from home. There's, I think, only 6 people left in our office, but services are still being provided. Any claims are still being reviewed and dealt with, and life and business goes on as usual. I'd also like to say that if your home or auto is insured by our parent company, Intact Insurance, or if you are insured by our sister company, Bel Air Direct, they are in the same state. All services are being provided, while 95% of staff at both of those companies are working from home as well. So services are being provided, everything's up and running. It's a different environment for sure for most staff, but like I say, we're there and ready to deal with any claims that you may have and to respond to any questions that you may have with regarding to your insurance coverage. Scott, next slide. We are getting a lot of questions coming in with regarding closing of parks and trails. Most municipalities have closed their community halls, their arenas, and other public buildings within their municipality. And we have not given any direction as to what you should or should not do. That is a local decision as to what you should close and what you should remain open for your municipality. We just provide the advice, and whatever your decision is locally, your insurance coverage continues. We've seen a lot of these signs. We've reviewed them from various municipalities across the province, various client municipalities across the province, and these seem very appropriate, and I see a lot of them posted now in parks and on trails and so on across the province. As far as parks and trails are concerned, a number of them have been closed. They followed suit with the federal government and the provincial government, who have closed the national parks and the provincial parks. I will say for provincial parks, I live within 1 kilometer of a provincial park, and the park superintendent has indicated that there is some leniency for people who want to walk in the park. I don't want to say that that's for all parks, but for the local park, that is some leniency that has been provided. But you may close the park completely. But I can see a lot of people that say, well, I live in a high-rise apartment building. I've got children who are needing to burn off some extra energy. I'm going to ignore the park closure and go use that open space to allow those children to run around and burn up some of that energy. If you do see that happening in your community and you do know that the park is closed, the open space is closed, you do have a requirement under the Occupiers Liability Act and a duty of care that's provided under there. And if you do see people using the park, even though it is closed, that you should still inspect that park periodically and look for any defects that might be in that park. And also remember, if you have a trail and it is considered a recreational trail, you do have the ability under the Occupiers Liability Act for a lower level of service on those recreational trails, but you still have to provide a level of service. And that could be, and I'll talk about it in a couple of slides after this one. But again, we haven't been making any recommendations as to closing or leaving parks open. That is a local decision based on the information that you're receiving from your local public health units, and you make your decisions locally, and we will support whatever decision that you have made. Scott, next slide. One of the things is the MMS, as Charles has mentioned, is one of the defenses that you can use. And I point here to section 44.1. Charles referred to 44.3, which is the defenses that are available under the Municipal Act. But I am sure that when the Municipal Act was rewritten in 2001, I think it was published, the current version, when they looked at 44.1 and wrote this out, that the municipality that has jurisdiction over a highway or bridge shall keep it in a state of repair that is reasonable in the circumstance. They never thought that reasonable in the circumstance might apply to a pandemic. And I think that's what you have to keep in mind as we go forward with this, and especially if this pandemic and the restrictions under the pandemic do last for an extended period of time. But during this time, if you do have staff that are unable to work because they do have the virus, and hopefully no one does contract the virus, or because they have to self-isolate at home, is that you continue to patrol your roads. I think that is very important to do that, and to monitor what you can and then determine what you can and cannot do by triaging your road system and deciding what is important and what needs to be done today based on the type of roads that you have in your municipality. Set your priorities and provide service to meet those priorities, even though those priorities may be different than what you have been able to provide in normal circumstances. But when you are setting those priorities, you must take into consideration the reduced workforce that you have in your municipality and make those decisions accordingly. I believe that if you act in good faith, I can't see how a judge can take and say, well, what you were doing, you did the best you could, you acted in good faith, and you provided what was reasonable in the circumstance. The only other point I would like to make here is that if you are in an upper tier, lower tier situation, you might want to look and see what your neighbors are doing as well. I think there is some benefit in consistency across a region. So if all other municipalities are reducing service in one area, let's say, for example, I pointed out roadside mowing for one of the examples here, because that is not included in the MMS. So if all other municipalities have started to say, well, let's reduce the roadside mowing this year because that isn't as critical, except maybe at intersections where sightlines might be restricted because of long grass interfering with the view of the road and blocking the view of oncoming traffic at an intersection. Maybe you should look at, well, should we do that across an area and across all municipalities? Let's make a decision across the area and to what services might be critical and can need to go forward, and what services may need to be replaced and done differently. So that's my recommendation for that is, again, some consistency across the region might be important. Next slide, Scott. As always, we recommend that you document everything. Document. That's what how we manage the risks in our municipalities, and what we want to see in any situation is good documentation. So as always, document everything you do. Document the work completed. Document how the priorities have changed or the level of service changed due to the reduced workforce. And then add to that documentation how you've changed what type of workforce you had. Was if 1/3 is away or 50% is away. Document that and keep track of that so that we can demonstrate that, yeah, during this time frame when this claim came in or collision occurred, yes, the municipality had a reduced workforce by 50%. They did a proper triage of services that they provide. They set the priorities based on that, and then they acted in good faith in trying to deliver those services. That's the primary messages that I wanted to get out today. Scott, next slide. One of the things that, and this is, we've heard this, wash your hands, cough into a tissue or your sleeve. One of the things that haven't come out in a lot of conversations is avoiding touching your face. I think that's maybe starting to circulate right now, but touching a surface when you're out in the store or happening to get out and then touching your face, whether you're gloved or not, doesn't matter. Avoid touching your face at all times. And I know that is a very difficult thing to do, but please take that into mind. Scott, next slide. And again, social distancing is key. I think from what I see here where I live, social distancing is being practiced and being practiced quite well. We're staying that 6 feet or greater apart here, and hopefully that's true across the province where you live. With that, Scott, my thank you slide, And again, by all means, hope everyone stays healthy. And by all means, be happy. I know there's a lot of stress going out there around because of the virus. And by all means, we have to take time to laugh and be happy and enjoy our family at this time, even though we can't maybe be with the friends we normally are in contact with. By all means, take time and be happy. Scott?
Thank you, Brian. So we have approximately 20 minutes left here. If folks online have questions, I would again direct you towards the question module or the chat module to have those posed. I will do my best to pose them to Brian and Charles and get you an answer. In the interim, I'll put this question to Charles, specifically with regards to the provincial emergency declaration. What impact does that have on declarations that are being made at the local level by councils?
Right. So, Scott, the answer is the impact is such that if a local council makes a declaration, it has to be consistent with the provincial declaration. So I'll give an example. As you know, the province has recently ordered that non-essential businesses close. A local municipality cannot issue its own emergency order allowing any of those non-essential businesses that the province has ordered closed to reopen before the province has said so. It's a simple question of constitutional hierarchy. Anything that the province does pursuant to its legislation cannot be overridden by a lower tier municipality pursuant to a bylaw or pursuant, in my view, to an order made under the statute. So as long as it's consistent and no less restrictive, it's fine. My idea is, of course, by making that declaration, you've got that ability to make orders on the fly, and they can be more tailored and specific to your local needs beyond what the province has ordered that applies to everyone in every municipality.
Okay, now further to the idea of the emergency declaration, does that in any way impact how municipalities should be managing their roads relative to the minimum maintenance standard? And I would put that question to both of you.
Well, I'll start by saying I agree with everything Brian had to say about prioritizing, about record keeping during this critical time with respect to the decisions that are made about non-essential maintenance activities versus critical maintenance activities. And Brian, I believe, did a fantastic job pointing out Section 44(1) of the Act, that the circumstances would include the pandemic, as well as what's called the character and location of the highway. Obviously, I've privately recommended to my own clients that their Class 1 high traffic volume, high speed roads, as always, take the highest priority over any Class 5 residential street where you've got low speeds and low volume. It's always been the case that when focusing on public safety and putting out resources, especially during winter maintenance, that everyone tends to focus on the higher volume, higher speed roads. And that makes sense. The bad accidents more likely will happen on those roads than on a low speed residential street where people normally don't get up much over 40 or 50K unless they're acting really crazy, in which case suing is never a good idea. It doesn't tend to work out well for those folks. Brian?
Yes, thanks, Charles. My view is too, and I should have maybe mentioned this in the slide deck, but thank you, Scott, for the question. Another thing you might want to consider, and I've seen it here locally as well, is there are a lot of people out walking and bicycle riding. I've seen a number of people out getting their bicycles out early because of this early and beautiful spring we're having so far. And if you do have bike lanes or bike routes in your municipality, and because people are trying to find activities for their children to do, they might be out in full force riding their bicycles and wanting to take advantage of those bike routes and bike lanes that are there. So maybe the patroller should, when he's out, or he or she is out doing that patrol, take a close look at the bike lanes and those bike routes and ensure that they are maintained in a good state of repair. Because I can see as this goes on and people are looking for things to do, they might be getting their kids out and riding their bikes more frequently, and it might be appropriate to keep a closer eye on those bike lanes and bike routes. Thanks, Scott.
Okay, I want to build on a point that Charles raised in passing. He was referencing New York City and the road closures taking place, or the road closure to traffic that was taking place in order to provide people with adequate amounts of personal space and social distancing. The Globe and Mail is now reporting that both Vancouver and Toronto are entertaining similar proposals or considering similar initiatives. And we're starting to see smaller communities also look at this. Run us through the steps, both from a legal perspective as well as from an operational perspective, about what would be required during an emergency to undertake an action like this. What are the steps one would take? Talk about signage. Anything else you think may be relevant to our audience?
All right. Well, I'll start with the legal requirements, and Brian will deal with the actual how to do it. Signage requirements, because that's his area of expertise. From a legal requirement, one of two things: you either have to pass a bylaw pursuant to the Municipal Act to temporarily close a road, or you declare a local state of emergency, as I've said under Section 4, and an order is made pursuant to that, affecting the same result, which is on a temporary basis, roads are either partially or fully closed to vehicular traffic to permit pedestrians. That's the two ways that I see from a legal standpoint that this can be legally done and effectively done. And obviously, although Brian can speak to specifics, you've got to put up some sort of warning sign, put out a public notification on your website, maybe put up some sort of physical barrier if you want to prevent vehicles from driving down the road and running anyone over who's using the roadway as a pedestrian way during the temporary closure. Brian?
Scott, would you mind repeating the question? I was making a note to self when you were asking Charles the question, and I didn't hear the whole thing.
I was just talking about the steps what a municipality would take to have to close their roads or alter how the roads are being used during this emergency. And I was building off the instance of New York City that is closing roads to provide traffic. They're closing roads to traffic to provide pedestrians with social distancing.
Okay, sorry. Well, again, as Charles mentioned, I think you have to put up some type of barrier or barricade and road close signage if you are closing certain areas to traffic and you want to keep that traffic out exclusively. I can't see any other way to do that, especially if you're just allowing an area for people to walk that has giving them additional space. A number of municipalities are using those portable trailers with the road closed signs on them, and they have flashing lights, and that can be used with barricades as well. I do think that the municipality also needs to post notices of this on their social media pages, on their websites, and notify police and fire and ambulance services of the road closure in case there is an emergency that they don't need to be delayed by having to take that route and then find their own detour. They're well aware in advance that detour is there. The road is closed and physically closed to traffic. Scott?
Okay. I hope I get the surname correct. It's Richard Petherick in Woolwich Township has asked if a municipality has opted to send staff home to keep them from the workplace, not due to illness or self-isolation needs. Does that open us up to more liability because it is our decision to reduce the amount of work we can perform?
So as a lawyer, I would say no. I mean, the truth is that what people have done in sending staff home to work remotely for the non-essential services, I don't believe any judge in their right mind will question that decision in light of the provincial state of emergency and the order that flowed from it. Quite the contrary, I think it's fully justified. Now, that having been said, essential services are essential services, and the priorities that the City of Toronto pandemic plan highlighted are key and need to be kept in mind. You've got to keep your critical infrastructure operating, even if there's a risk to employee health. Your obligation, as I understand it as an employer, is to mitigate the risk as best as possible. That may include providing a mask and gloves to certain employees, ensuring that they're kept physically separated as much as possible to prevent the spread of the virus. But if people have to come in and do their jobs in order to keep those critical services operating, then short of them going on strike and refusing to work, you've got to have them do their jobs, in my view. Obviously, I'll point out to everyone listening, I'm not an employment law specialist. I don't deal with union contracts, but as a tort defense lawyer, I'm constantly dealing with how the municipality staffed their departments, including obviously road departments, at any particular time during a winter, and that you always are confronted with people who are sick, people who are not coming in, as well as equipment breakdown and failures, all of these complicated factors that lead to a situation. So having said that, I don't know if Brian has anything else to contribute, but those are my thoughts on that question.
Thanks, Charles. I would definitely agree with that. Again, if the municipality does have administrative staff that can work from home and complete their job functions from home, there would be no problem there. And again, insurance company coverage would continue as normal. Again, we need the staff in the field, and they have to be there. You may have to look at alternate ways of providing the service as well. If you need to social distance with staff in the field, maybe it's sending more than one truck to a job site might be necessary in order for you to social distance while at work. If you need more than one person to complete a task at a certain location, you may have to send more than one vehicle there, which is understandable, and because everybody wants to social distance as much as possible. So these are exceptional times, and we have to adapt.
Okay, we have a question that we received by email. We're being asked if mayors, CAOs, or managers of road staff can make staffing changes to 10-hour days from full-time 8-hour days without proper notification or written agreements, as per the Ontario employment standards during this pandemic. Even when employees were asked and have said no, this is the question. Is it possible for a municipality to compel employees to undertake these modified work arrangements? And if so, recognizing again the caveats Charles put in place earlier about being an employment or not being an employment lawyer, what sort of repercussions would you expect to see?
Repeat the question, Scott. I had a little audio trouble.
No, just they're wanting to know if municipalities as employers can unilaterally impose work modifications from 8 hours to 10 hours without all the usual advance notice and the other steps that normally would be taken to undertake such a change.
Yeah, in terms of that, I would tend to think that, again, Section 4 of the Emergency Management and Civil Protection Act allows the head of council to make such orders or take such actions as they deem necessary. To me, provided it's not illegal. So unless there's a specific requirement in the Employment Standards Act or the Highway Traffic Act that requires certain prerequisites before you extend working hours, thinking about that regulation involving drivers' hours that Brian Anderson probably knows a lot better by heart than I do. But to me, that's a possibility. Dealing in a unionized environment obviously makes it a little extra difficult because you've got contractual issues as well as what the statute requires. Human resources needs to be engaged, and if there's any pushback, I would say start first by asking, and if there's a refusal or pushback, even if you're paying a certain amount of enhanced overtime wages, maybe that's a consideration to sweeten the pot. If you've got some money in the bank to pay double overtime rather than regular overtime to staff who are willing to work a little longer, then maybe you don't get into having to worry about forcing it on anyone. Hopefully you don't get to that point. Beyond that, you probably need to speak, as I said, to someone who's an expert in employment law, just to make sure that if you're not in a position to cooperatively work it out with your staff or union, then you need to get legal advice to make sure that any action taken is on all fours legally and there are repercussions later. It's the type of thing where hopefully everybody's working together and understanding the needs, and there's not going to be people digging their heels in. But if it happens, you have to be ready to deal with it appropriately.
Brian, did you want to add anything?
I can't see any issue with the hours of service or under your CBOR for that, because it allows a 16-hour day. Yes, I'd have to go back to my files to get the actual hours. I don't want to repeat things without having that in front of me, but I know it's a 16-hour day, and just going from an 8-hour day to a 10-hour day, I don't think I know there wouldn't be any impact there for hours of service. Thanks, Scott.
Okay, final question. We're almost out of time here. You referenced earlier, Brian, about collaborating with your neighbors when you're in a lower tier municipality. Do you see, from your perspective, what are the implications of the upper tier declaring an emergency when the lower tiers haven't? So is there extra obligations imposed on the lower tier municipalities? Are there other things that they should be taking into consideration when the upper tier has taken a step that they haven't at the lower tier?
I don't see any repercussions on the lower tier municipalities if they decide not to declare a state of emergency. Again, that's a local decision. I would think that the council for the lower tier municipality should be in contact with the council. Well, they're probably all in council for the upper tier municipality and the public health unit in deciding for themselves whether or not they need for the lower tier implement a state of emergency. But if they don't, I can say that wholeheartedly that their insurance coverage would still be there for them and without restriction.
Okay, and then you answered that quickly, so we have time for one last one.
Okay.
Quickly put here. There's a question as to whether or not the Highway Traffic Act hours of service basically it's asking what effect during an emergency, what impact does that have? Does the emergency supersede the stipulations required for hours of service? And perhaps you can jump in there, Charles.
Sure. I can say that I am not aware of a specific section of the Highway Traffic Act that deals with an emergency override of that particular provision. So I would recommend, even though we find ourselves in a crisis, attempting to comply with that hours of service legislation. Once again, we're in uncharted waters, and I don't know of many lawyers who've ever had to deal with the ramifications of the what ifs that we're talking about. But again, I point to the ability to declare a local state of emergency and the power, as long as it's not contrary to law, that the local head of council has. So to me, that still requires compliance with the Highway Traffic Act regulation and hours of work issue that we're talking about. I don't see that it can be overridden. It could be theoretically if the province stepped in, because that's provincial legislation that we're talking about. So if Doug Ford was to do that, and that may be something that heads of council may reach out to the provincial government about if they find that that's something that's urgently needed.
Okay, thank you. We are now out of time. We've filled our 1 hour allotment. I want to thank both Charles and Brian for taking the time to share their insights and counsel with us today. I know it stands to benefit municipalities, and our hope and expectation is you have something you can take away and put in use into your own operations in your communities. If any members on the line have questions that have not been answered and would like to pose to us, please, I would ask you to reach out to me at Scott, S-C-O-T-T, at OGRA.org. Again, that's Scott, S-C-O-T-T, at OGRA.org. And I will pose them to Brian and Charles and get back to you with an answer promptly. At the same time, if in your municipality you have concerns where OGRA can be of service, please reach out as well. Thank you very much. Hoping everyone stays 6 feet apart from one another and wishing everyone very good health. Talk soon.